Health experts say it is inevitable that COVID-19 is going to spread, but we can control how much it spreads. Dr. Christopher Ohl says with the time we've had to prepare and with new restrictions that are in place, like school closures, closing dining rooms and bars and restaurants, this should slow things down. Kirsten Gutierrez has our story.
Dr. Ohl says a number of confirmed cases of the coronavirus will likely double in the next week or two. He says they're testing more, and with more tests, there will be more cases. With more cases predicted to follow, Ohl wants to remind people to stay calm. He says the statistics of surviving COVID-19 are good.
So 85% of people still, that number hasn't changed. They're going to be fine. It's a mild to moderate illness. You can stay home. And it's nothing to worry about. We've been saying that all along. It's like having the flu.
He says with people practicing social distancing and other restrictions, it should help contain the outbreak.
And if we can get the virus transmission slowed down enough, it will make a difference.
When it comes to contracting the virus, Dr. Ohl wants to make something clear.
The virus is transmitted from a person who has the infection to a person who doesn't. Or it gets transmitted from a surface that the person has an infection, has got their cough droplets or something else on. Those cough droplets really are a problem only for a while. And it depends on the surface, but it can be anywhere from a few hours to maybe a day or two. If you clean that surface, soap and water, any disinfectant, Lysol, it's gone. It's dead.
He says the infection does not spread through a contact of a contact of a contact.
So let me explain. If there's a COVID-19 patient and one of their family members goes to, let's say, a school before we shut the schools down, and then one of those school people go to another place, and one of those people go to another place, but they're all fine. That does not expose you to COVID-19. You are exposed really only being around an exposed person.
Ohl says most people who are capable of transmitting the virus already have symptoms, but they can be mild. During allergy season, it might be hard to differentiate, but he says one thing is a telltale sign you might want to get tested.
Because a big component of COVID-19 is fever. 85% of people now, if you put all the studies together, have a fever. Allergies don't give you a fever.
Ohl says if you do not have a fever or cough, you do not need a test. When asked how long this pandemic would last, Dr. Ohl predicts longer than 2 weeks, but shorter than 3 months. He says we probably won't feel normal again until midsummer. In Winston-Salem, Kirsten Gutierrez, WXI 12 News.
Kirsten, thank you. We also asked the doctor if you were to come down with COVID-19, could you get it again once you get healthy? He says they're not 100% sure yet, but he believes that is unlikely. He says only time and science will provide definitive answers to that question. If you'd like to listen to his entire news conference today, head to our Facebook page. We have the full thing posted there for you.